General dentists have many skills in their armamentarium to not only relieve pain, but also repair and replace diseased dentition to natural form and function. These invaluable services offered by general dentists are essential in providing overall health and well-being to the patient population. From my personal experience, one of the most rewarding areas of dentistry is having the ability to alleviate pain, especially acute tooth pain. Generally speaking, diagnosis and the management of tooth pain is very straightforward. Most tooth pain characteristics tend to fit the classic pattern of site of pain equals source of pain. However, it's the site of pain that is not the source of pain that can humble us. Dentists are often challenged with pain complaints from teeth and oral structures that show no visual signs of pathology, with pain characteristics that seem to break the textbook rule of our perception of dental pain. In Dr. Bell's third edition textbook entitled Orofacial Pains Classification, Diagnosis, Management, he writes, "Some pain sources are easy to identify accurately and therefore present no diagnostic problem. Such complaints cause a minimum of alarm on the part of the patient, and the doctors have little difficulty managing them successfully. Other pain, however, are less easily related to the actual site of the noxious stimulation that induces them, so that both patient and doctor may have trouble determining the true source of the complaint. It is in this area of obscure pain that professional training, experience, and skill especially count." Dr. Weldon Bell. Unfortunately, the inability to recognize the characteristics of head and neck complex pain patterns can result in misdiagnosis and, in some instances, the performing of unnecessary irreversible dental treatment. To illustrate an example, a patient presents to a dental office with chief complaint of toothache. The patient states that she is in severe pain and she is convinced that the pain is from the upper bicuspid. Because of the severity of her pain, she is adamant that the dentist do something to get rid of her pain. And as often the case, the dentist performs root canal therapy on the bicuspid, only to have the patient return the next day with the same tooth pain. A decision is then made to perform an apicoectomy on the same tooth. When the patient returns to the dentist office a week later, the patient again states that she still has the same tooth pain. The decision is then made to remove the tooth. However, following the extraction, the tooth pain complaint continues. But now the pain has worsened. The question is why? Without the understanding of atypical pain characteristics in the head and neck area, the clinician, through confusion and/or frustration, may mistakenly conclude that the origin of the patient's pain is due to psychologic factors. This is where the orofacial pain specialist comes in. One of the differences between the general dentist and the orofacial pain specialist is in the area of education and training. In most undergraduate dental school curriculums, the diagnosis and management of orofacial pain, including temporomandibular disorders and sleep disorders, is either lightly touched on or not covered at all. The biopsychosocial modeling of pain is not adequately addressed. Instead, the emphasis is on doing. As clinicians, we must realize that sometimes less is more. Also, it can be difficult for a busy general practice to allocate the amount of chair time necessary for an adequate patient interview and comprehensive head and neck examination. Another difference is the orofacial pain specialist will have an enhanced knowledge of pharmacology due to the use of medications not typically prescribed in general dentistry. Medications that may have greater risk due to potential side effects and drug interactions. Consider the above example of the patient with the, quote, toothache, unquote. In this case, had the dentist been aware of the complexities and types of orofacial pain, a timely referral to the orofacial pain specialist most likely would have provided the correct diagnosis, maybe saving the tooth, not to mention avoiding unnecessary anxiety, frustration, and time lost. As stated in the American Board of Orofacial Pain website, the orofacial pain dentist must be competent in the diagnosis, treatment, and rehabilitation and prevention of orofacial pain disorders, which includes being knowledgeable in areas such as neuropathic pain, masticatory and cervical pain, musculoskeletal pain, neurovascular pain, psychosocial concerns, and sleep disorders, to mention a few. In many cases, the management of the orofacial pain patient will require a multidisciplinary approach in order to achieve successful management, which results in pain reduction. In conclusion, the rapidly evolving field of orofacial pain is a vital dental specialty. Recognizing and knowing when to refer a patient to an orofacial pain specialist will be a win-win situation for the dental profession as well as the overall patient population.